Welcome to osteology classes of thorax. So in today's session, we are going to learn about osteology of ribs. So there are 12 pairs of ribs that articulate with the thoracic vertebra and extend or towards the sternum. So here are the ribs which are present on each side of the sternum, forming rib cage. A typical rib extends from the thoracic vertebra posteriorly to the lateral border of the sternum. So posteriorly, thoracic vertebra, sternum anteriorly, so if you see a typical rib, we can see it is extending posteriorly from the thoracic vertebra, making a joint here, and anteriorly it articulates with the costal cartilage. Costal cartilage articulates with the lateral border of the sternum. So their ends are connected to the costal cartilage. So you can see anteriorly the ends are connected to the costal cartilage, and the ribs along with the costal cartilage constitute the costa. So rib, here is the rib plus costal cartilage, together called as costa. So they can increase the anterior, posterior and transverse diameters of the thorax by their movements. So normally there are 12 pairs of ribs, but occurrence of accessory like cervical or lumbar rib may increase them to 13 pairs, or absence of the 12th rib may reduce the count to 11 pairs. Now let us classify the ribs according to their features. So based on the features, we can classify the ribs as typical and atypical ribs. So the typical ribs are 3rd to 9th are the typical ribs. So 3rd, 4th, 5th, 6th, 7th, 8th, 9th ribs are considered as typical ribs. And atypical ribs, the first one, second one and 10th, 11th, 12th. So here is the 10th, we can see 11th and 12th doesn't reach anteriorly to articulate with the sternum. So here is the posterior view of rib cage where you can see the 11th and 12th ribs. So this is 11th and 12th, and we can see their ends doesn't reach till the sternum. So these are the floating ribs. So atypical ribs are 1st, 2nd, 10th to 12th. So the typical ribs share the common features. Atypical ribs are unique in their own ways. Now classify the ribs according to the relation with the sternum. So based on the relation with the sternum, we can classify the ribs as true ribs and false ribs. So the true ribs are upper 7 ribs, that is 1 to 7. First to 7th pairs of ribs are true ribs, whereas the false ribs are 8th to 12th. So the lower 5 pairs ribs are false ribs. So if we see the true ribs, they articulate with the sternum anteriorly, whereas the false ribs do not articulate. So we can see the 1st to 7th rib, they articulate directly with the sternum with their corresponding costal cartilage, whereas the rest of the ribs, that is 8th to 12th, you can see 8th, 9th, 10th, they articulate with the preceding vertebra, that is with the sternum, to form the anterior costal margin. So the false ribs articulates with the more superior costal cartilage. So we can see 8th articulates with the 7th here and 9th articulates with the 8th. So all they articulate to form a margin here, which is the anterior costal margin. So let us discuss the types of ribs based upon their articulation. So vertebrosternal ribs. So vertebrosternal ribs articulates posteriorly with vertebra. So here are the vertebrosternal ribs example, where it articulates posteriorly with the thoracic vertebra and anteriorly with the sternum via the costal cartilage. So these are vertebrosternal ribs. And the next are vertebrochondral ribs, which articulates posteriorly with the thoracic vertebra and anteriorly their cartilages join with the cartilage of the higher rib to form the anterior costal margin. So 8th, 9th, 10th are the examples of vertebrochondral ribs. So the last variety are the vertebral or the floating ribs. So the vertebral or floating ribs articulates posteriorly with vertebra, but their anterior ends are free. So 11th and 12th we can see here, and 12th ribs, they are the floating ribs. So 1st to 7th are vertebrosternal ribs. And 8th to 10th are vertebrochondral. And 11th and 12th are floating ribs or vertebral ribs. Which do not articulate with the sternum anteriorly. So one thing we have to note here, the first 7 are the true ribs which attach sternum by costal cartilages, whereas the remaining lower 5 are the false ribs either join the respective costal cartilage, that is the 8th to 10th, or they are floating, just they are the vertebral which doesn't reach the sternum, so they are 11th and 12th. So let's talk about the joints of the ribs. So the ribs 2nd to 7th attach sternum by synovial joints. So 2nd, we can see here 2nd, 3rd, 4th, 5th, 6th and 7th. So these joints are plain synovial joints. And ribs from 6th and 9th attach with each other by interchondral joints. So 6th and 9th, here we can see the interchondral joints. Interchondral joints, that 6th and 7th, and the joint between the 7th and 8th, and the joint between the 8th and 9th. So 7th and 8th, and the joint between the 8th and 9th. These are all the interchondral joints, which are also the plain synovial joints, while the joint formed between the 9th and 10th costal cartilage is more of fibrous like. So it is a fibrous joint. So joint between the 10th rib and the 9th rib. So here, so this joint, this is the 9th rib and here is the 10th rib. So this is a fibrous joint. The first costosternal joint is fibrocartilaginous joint. So here is the costosternal joint, which is fibrocartilaginous joint, that is a white fibrocartilaginous joint. The ligaments are like lateral and medial interchondral ligaments are the ligaments which are associated with these joints. The interchondral joints are the plain synovial joints. They provide little or no movement, and they only allows slight gliding movements during inspiration and expiration. So this is all about the joints of ribs. So let's see the features of a typical rib. So here is the anterior view, and this is the posterior view of the typical rib, where we can identify the typical rib on its posterior end having head, neck and tubercle. So this is the head, the constricted part is the neck, tubercle, and it has got the body. So these are the parts of a typical rib. If you see the head head articulates with the corresponding vertebral body. So we can see here the head articulates with the corresponding vertebral body and intervertebral disc, and the next higher or the preceding vertebral body. Shaft of the rib or the body of the rib, it turns sharply anteriorly at an angle and has a costal groove. So we can see it turns sharply. So here is the body which turns at an angle. So here is the anterior view of a typical rib where the body turns sharply anteriorly at an angle, which is called as costal angle, and which is present approximately 5 centimeters in front of the head. So here is the costal angle. And inferior border is related to a groove. So groove is present, a costal groove on the inferior and internal surface of the rib. So here is the internal surface where we can appreciate the costal groove here. So this costal groove, it lodges the intercostal vessels and nerves. The tubercle articulates with the transverse process of the corresponding vertebra. So here we can see the articulation of the tubercle with the transverse process of the corresponding vertebra, except for the 11th and 12th ribs which doesn't have the tubercle. So these are the common features of a typical rib. Let's see the parts. So each rib has got the 3 parts: anterior end, posterior end and shaft. So here is the sternum. So this is the anterior end. And body or shaft. So the anterior end, it bears a concave depression, where the concave depression is here, where it articulates with the costal cartilage to form plain synovial joints. Whereas the posterior end, that is the head neck tubercle. So it has got head, neck and tubercle on its posterior end. The shaft is the longest part and extends between the anterior and posterior end. And the shaft is flattened, and the inner and the outer surfaces, that is, it has got the inner and outer surfaces, and it has got the upper and lower borders. And it is curved with the convexity directed outwards and bears a costal groove on the inner surface near the lower border. So it bears a costal groove here which lodges costal vessels and costal nerve, intercostal vessels and nerves. So 5 centimeters away from the tubercle, so here is the tubercle, the shaft bends abruptly and it changes its direction, which is called as the angle of rib. So here is the angle of the rib, which is present 5 centimeters in front of the tubercle. So how to determine the side and anatomical position of the rib? The side of the rib can be determined by holding it in such a way that its posterior end having head neck tubercle and it is directed posteriorly, and its concavity faces medially, and its sharp border is the directed inferiorly. The sharp border is near to the costal groove, which should be on the inferior side. Let's see some features and attachments of a typical rib. An anterior end, it bears a small cup or like shaped depression which joins with the corresponding costal cartilage. So the anterior end bears a small depression where it articulates with the costal cartilage and to form a primary cartilaginous or costochondral joint. The posterior end presents head neck tubercle. So here is the posterior view of the rib, where the posterior end presents head neck tubercle, and head has got 2 articular facets, lower and upper. So we can see this is the lower facet and here is the upper facet. So the lower larger facet articulates with the body of numerically corresponding vertebra. So this lower facet, it is quite larger than the upper one, and it articulates with the corresponding numerical vertebra. Means if the rib is the second rib, it articulates with the second thoracic vertebra. If it is the fourth rib, the lower facet articulates with the corresponding fourth thoracic vertebra. The upper smaller facet articulates with the next higher vertebra. So this is the upper smaller facet which articulates with the next higher or preceding vertebra. The crust separating the two articular facets lies opposite at the intervertebral disc. So between these two facets, this is the crust. We can see in this particular image the crust separating the two articular facets lies opposite to the intervertebral disc. So here is the crust which is opposite to intervertebral disc. So next about the neck. Neck, it lies in front of the transverse process of the corresponding vertebra. So here is the neck which is in front of the transverse process of corresponding vertebra. And next is the tubercle. Tubercle is situated on the outer surface of the rib and it is at the junction of neck and the shaft. So this is the body and shaft. Here is the tubercle. And we can see the tubercle articulates with the transverse process. So the tubercle, if we see clearly, the tubercle has got two parts. The medial articular part. So this is the medial articular part. And lateral non-articular part. So the articular part bears a small oval facet. So we can see here the articular part bears a small oval facet. So we can see the articular part articulates with the transverse process of the corresponding vertebra in this particular image. The non-articular part is rough and provides attachment to ligaments. Next we shall talk about the shaft or the body. The shaft of the rib is thin and flat and it is curved. The curve becomes more prominent at the costal angle. We know the costal angle, it lies 5 centimeters in front of the tubercle. So here is the turn which is called as the costal angle. So here at the costal angle, the rib turns anterolaterally. Costal angle also marks the attachment for some deep back muscles onto the ribs. The internal surface of is concave and it contains the costal groove. So here is the image. We can see the ribs are here. So this is the outer surface or the anterior surface. Here is the upper border, lower border, and internal surface is concave and it contains the costal groove. So here is the costal groove where we can see the neurovascular bundle. So this costal groove protects the neurovascular bundle, supplying the thoracic cage. And contents of the costal groove from above downwards, it is formed by intercostal vein. So first is the intercostal vein, then intercostal artery, and the last one is the intercostal nerve. We can say it as van structures are present in the costal groove. The costal groove is prominent only on the posterior aspect of the rib and it becomes indistinct on the anterior side of the rib. We can see the body. It ends with a cup for the costal cartilage. So here it ends forming a cup for the costal cartilage which allows the rib to articulate with the sternum. Let's see the attachments of the rib. External intercostalis. There are 11 pairs of external intercostal muscles. These are most superficial in the area. So this is external intercostal. So the external intercostal muscle extends from the lower border of the costal groove to the outer margins of the upper rib. So it extends from the costal groove from above and to the outer margin of the upper border of the succeeding rib or the rib which is present below. So the fibers of this muscle pass antero-inferiorly in an oblique manner and extend around the thoracic wall from the tubercles to the costal cartilages of the ribs. And these muscles develop to elevate the ribs during inspiration. The second set of muscles are the internal intercostal muscles. So there are 11 pairs of internal intercostal muscles and are found posterior to the external intercostal. So deep to external intercostal is internal intercostal muscle. So internal intercostal muscle, it originates from the inferior margins of the costal cartilage and the inner lip of the costal groove. Their fibers course posterior-inferiorly and medially to insert the superior border of the immediate inferior rib. So we can see it gets inserted to the superior border of the immediate inferior rib, and their fibers course posterior-inferiorly and medially to insert the superior border which is present just below it, that is the immediate inferior rib, and these muscles are only present from parasternal area to the angle of the rib and further continues as posterior intercostal membrane on posterior aspect. So their action is to depress the ribs in forced expiration. So innermost intercostal muscles are the deepest. So here are the innermost intercostal muscles. So these muscles are the deepest and they originate from the upper border of the costal groove of one rib and they course inferomedially in the same fashion as the internal intercostal muscle and insert into the upper border, that is the inner lip of the upper border of the rib which is present just below it. The three characteristics of a typical rib. First characteristic is the costal angle. So the costal angle which lies 5 centimeters. It lies 5 centimeters in front of the tubercle of the rib and also the other faint angle which is present 2 centimeters posterior to the anterior end. So this is the second angle which is not that prominent as the posterior costal angle. And the second characteristic is that it is curved along its entire extent. So typical rib, if you see, it is curved all through its entire extent. The third characteristic is it is twisted in such a way that the typical rib, the two ends of the typical rib never touch the same horizontal plane. So however you keep, both the ends, anterior and posterior ends, never touch the same horizontal plane. So these are the characteristics of a typical rib. So the next we shall continue the osteology of ribs with atypical ribs. So in previous session we have seen about the typical ribs and now the atypical ribs are the first, second, 10th to 12th ribs are known as atypical ribs and they are considered individually. So first we will continue with the first rib. So the first rib is the broadest and shortest of the true ribs. So here is the image of first rib, which is the broadest and shortest of all the true ribs. It is broad and flat and it has single articular facet on its head. So you can see. And this single articular facet, it articulates with the first thoracic vertebra. And as in the typical ribs, the tubercle has a facet for articulation with the transverse process of vertebra. So here is the posterior view of the first rib where we can appreciate the tubercle. So tubercle showing the medial articular part and which articulates with the corresponding, that is the T1 thoracic vertebra, first thoracic vertebra. The superior surface is unique in that it is marked by two grooves that allow the passage of subclavian vessels. So these grooves . So the grooves are for subclavian vessels. So these grooves are separated by a tubercle called as 𝐒𝐻𝐿 tubercle. So you can see these grooves, and these grooves are separated by this tubercle. So 𝐒𝐻𝐿 tubercle to which the anterior 𝐒𝐻𝐿 muscles attach. So scalenus anterior muscle attaches to the 𝐒𝐻𝐿 tubercle, and also it provides attachment to costoclavicular ligament. So anterior part of the 𝐒𝐻𝐿 tubercle provides attachment to scalenus anterior, and posterior part of the 𝐒𝐻𝐿 tubercle provides attachment to costoclavicular ligament. And over the superior surface, the area in front of the anterior groove and near the anterior end provides attachment to subclavius muscle. So subclavius muscle gets its attachment in front of the subclavian groove anteriorly, and there is no costal groove where we can on the inner surface. So here from the posterior view, where we can see the inner surface is quite smoother, not like the superior surface, and inner surface is related to the pleura and the lungs. The first rib has no costal groove on its inner surface. The anterior is larger and thicker, so the anterior end is quite larger and it is thicker, and inner border provides attachment to 𝐒𝐮𝐻𝐿 fascia. So here is the inner border of the first rib, which provides attachment to suprapleural membrane or 𝐒𝐿 fascia. So let's see the structures related to the neck. So anterior relations of the neck from medial to lateral. So the medial most is the sympathetic chain. Next to sympathetic chain, anteriorly the neck is related to first posterior intercostal vein. And next to the vein, neck is related to the superior intercostal artery. And next to the artery, it is related to the ventral ramus of the first thoracic nerve. So we can remember to memorize these relations. You can remember as chain pulling the van or swan. Simply we can remember it as swan. S stands for sympathetic chain, and V for the posterior intercostal vein, A for the superior intercostal artery, and N for ventral ramus of the first thoracic nerve. So these are the relations, anterior relations of the neck of first rib. And let us understand which side the first rib belongs to. So the side determination is done by keeping the rib on the tabletop, considering its position on your own body. And now note the rib belongs to the side on which its both the ends touch the surface. So if the rib is placed on the wrong side, then only its anterior end will touch the surface. So it will be touching the surface, whereas the posterior end is elevated little higher. So by seeing that, we can identify which side the first rib belongs to. The next atypical rib is the second rib. If you see its length, the length is twice that of the first rib. So its shaft is sharply, highly curved, and its shaft is not twisted like a typical rib. Hence, both the ends of the rib touch the tabletop when you place it on a horizontal surface. So its main unusual feature is its roughened tuberosity on its superior surface. So we can see the roughened tuberosity on its superior surface. which forms a part of the origin of serratus anterior muscle. Near its middle, the outer convex surface of the shaft presents a rough impression or a prominent tubercle which provides attachment to the serratus anterior lower part of the first and whole of the second digitation. The posterior part of the internal surface presents a short costal groove. So the costal groove is not that prominent as a typical rib, but still a faint short costal groove is observed on the posterior part of the internal surface of second rib. The upper border and the adjoining part of the upper surface provide attachment to scalenus posterior muscle. So the upper border scalenus posterior and serratus posterior superior muscles also gain their attachment from the upper border of the second rib. And there are two facets which are present on the head to allow the articulation with T1 and T2 vertebra. So you can see so here it articulates with the T2. This is interarticular crust. So these are the main features of the second rib, which are distinguishing features of the second rib from a typical rib. So next we shall move on to 10th rib. The 10th rib distinguishing features are it has a singular articular facet on its head, which articulates with the body of the corresponding 10th thoracic vertebra. And otherwise it appears to be almost like a typical rib, but the 10th rib is slightly shorter than a typical rib. Let's move on to floating ribs, that is on 11th rib. The distinguishing features of a 11th rib, it has got a large single facet, articular facet on its head. So we can see a single articular facet on its head, and it has no neck or no tubercle. So there is no neck and no tubercle. This is the posterior view of 11th rib. So there is no neck, no tubercle for the 11th rib. Its anterior end is pointed and tipped with the cartilage. It has a slight angle and a shallow costal groove. So the costal groove is on the inner surface. So this is the interior of a 11th rib where we can see a shallow costal groove and a large articular facet on its posterior end, that is the head, and anterior end is pointed, which is covered by a thin plate of cartilage. So the inner surface is directed upwards and inwards, and it has got a very slight angle. The next we would discuss with the 12th rib. The 12th rib has same features as 11th rib. The only difference is there is no angle. 11th rib presents a slight angle, but there is no angle for the 12th rib, and there is no costal groove on the 12th rib. And 12th rib is much shorter than the 11th rib. So here is the 12th rib, which is much shorter than the 12th, and there is no angle and there is no costal groove, and it is much shorter than the 11th rib. And how to determine the side? The side of the 12th rib can be determined by keeping the rib in such a way that its pointed anterior end is directed anterolaterally and its broader posteromedially. Its slightly concave surface faces inwards and upwards, and sharper border is directed inferiorly. So this is how you identify both 11th and 12th ribs side. So some points which you have to note during this osteology of the ribs. So the 10th rib has a single articular facet on its head, which articulates with the 10th thoracic vertebra. That is one thing you have to note. And 11th and 12th ribs have a single articular facets on their heads, have no neck or tubercle. And the ribs from 8th to 10th are vertebrochondral with no direct articulation with the sternum. So their costal cartilages articulate with each other and with the 7th costal cartilage. And the ribs of 11th and 12th have free anterior ends which are floating ribs, and definitely they are never going to reach the sternum. So these things you have to know during the osteology of ribs. And let us discuss with some clinical aspect, that is the clinical correlation of the rib. First point is on chest drain insertion. This is a commonly preferred procedure and is necessary in the cases of pneumothorax or pleural effusion, and even empyema or post-operatively following a thoracic surgery. So it is particularly important to place the tube in line with the superior border of the rib. This is because the neurovascular bundle, that is the intercostal nerve, vein and artery which are present in the costal groove, passes along the inferior border in the costal groove. So which is located near the inferior border. That is the reason you have to place the needle in the near the superior border in order to prevent injury to neurovascular bundle. And this positioning minimizes the risk of damage to surrounding structures. Next we would discuss about the rib fractures. The fractures of the rib tend to present with pain on respiration, coughing, laughing or most other chest movements. So here is the image which presents the rib fractures. You can see here. So they are most typically caused by blows or crushing injuries. The weakest part of the rib is just anterior to its angle. So it is near the 5 centimeters in front of the tubercle is the angle of the rib. So just anterior to the angle is the weakest point of the rib, and it is the most common site of injury. However, it is important to remember that the direct blow can lead to the fracture at any point. Fleal chest, 𝐒𝐿 chest, when ribs are fractured at two sides. So here is an image where it shows the fracture of the ribs at two sides. And when the ribs are fractured at two sides, anteriorly as well as at the angle, so it results in fleal chest or 𝐒𝐿 chest. So the fleal segments of the ribs are sucked during inspiration and pushed out during expiration. So these segments are sucked during inspiration and pushed out during expiration, leading to a clinical condition called as paradoxical respiration. The next condition is the cervical rib. The costal element of C7 vertebra may elongate to form an extra rib called as the cervical rib, which is present in about 5% of individuals. So here is the image which explains the cervical rib. So there it is bilateral, it is present on here also, cervical rib. So which is the extension of the transverse process of C7 vertebra, which is present in 5% of individuals. The condition may be unilateral or bilateral, and it occurs more often unilaterally and somewhat more frequently on the right side than on the left side. The cervical rib may have a blind tip. The tip may be connected to the first rib by a fibrous band or cartilage. So you can see here the fibrous band connecting the tip of the cervical rib to the first rib. So the cervical rib blind tip, it is connected to the first rib by means of fibrous band or cartilage, and it may compress the lower trunk of brachial plexus and subclavian artery. So we can see on one side of the image where the lower trunk of the brachial plexus and subclavian artery are compressed because of cervical rib. So this compression produces the pain along the medial side of the arm and the hand, and also it causes the disturbance in the circulation of upper limb. And the next clinical feature is the lumbar rib. The lumbar rib is otherwise called as the gorilla rib. It develops from the costal element of L1 vertebra. So just like the costal element of C7, here the costal element of L1 vertebra grows laterally to form the gorilla rib or lumbar rib, and its incidence is more common than cervical rib, but remains undiagnosed as it is usually does not cause symptoms, and it may be confused with the fracture of the transverse process of L1 vertebra. So this completes the osteology of atypical ribs. Thank you.